Now, Hennepin Healthcare is working to stabilize its leadership. The hospital board appointing Dr. John Cumming today as the new interim CEO, effective Friday. Dr. Cumming led HCMC during a previous transition. This all follows the resignation of two top hospital leaders in recent days. It is a critical time for HCMC as it deals with a massive budget deficit and trying to secure long-term funding. HCMC is pushing for state leaders to raise the Hennepin County sales tax created to build Target Field by 1%, with most of that money going to try to keep the hospital open. But it is not the only major hospital in our area struggling financially. Jennifer Hoff joins us with more.
Julie, we're going to talk about North Memorial. That's a hospital in Robbinsdale that has been sounding the alarm as well for several years. And despite sharing so many similarities with HCMC, it's never gotten any kind of additional financial help.
The Hennepin County Medical Center may be making headlines now, but just 7 miles north, a similar hospital faces the same financial hurdles, despite North Memorial Health's CEO sounding the alarm for several years.
What's different about North Memorial is we've never had any sort of supplemental funding.
The Level 1 Trauma Center has more than 100,000 emergency room visits every year and 75% of its patients covered by government programs. A key safety net hospital laying off employees, still down $50 million in 2025.
The problem has gotten so substantial, we just can't cut ourselves out of this problem.
Trevor Sawallish supports the Hennepin County sales tax proposal, even if it's just $24 million a year, the bulk of it going to HCMC that, unlike North Memorial, also pays for other federal tools to close the Medicaid reimbursement gap that's only getting bigger to changes in work requirements and eligibility restrictions.
Even if we did get the tax, that's not going to be enough to make sure that we have a sustainable health system for the Twin Cities, for the state, for the region. It's going to take some investment for us to create new ways of doing things in healthcare, and it's incredibly challenging when you're already weak financially.
Sawallish suggests partnering with other hospitals to create a bigger system and be more efficient.
There is waste in the system. There are a lot of middlemen in the system.
Closing isn't an option, but if the hospital to its south actually does, could North Memorial handle twice as many patients?
The question's a good one, but the answer is no. There don't seem to be many things that we could look at and say, yeah, that's a net positive for what's coming.
Pretty candid interview at that. Sawallish will be one of many leaders at the Capitol on Thursday when that sales tax bill gets its first committee hearing. Lawmakers giving it mixed reviews thus far, saying that you can expect many amendments to it. HCMC adamant without state help, it would have to start closing, at least announce that it would be closing already come June, Julie. So
well, yeah, and I think it's discouraging for people to hear, even if they pass that, it's just a temporary relief. I mean, this is a huge problem that seems like it's only going to grow.
A big problem, and one that I've tried to make clear in my reporting, at least over the last several days, that this is not just HCMC. It's not just now North Memorial. This is going to hit hospitals really all across the country starting next year. And I really appreciate the candidness of a lot of these CEOs. We've had some big names sit down with us in the last couple days, and I think it's important for them to be upfront about what's happening
and what we need to do to fix it. All right, thank you, Jennifer.